My son, who was 8, he went to school in September 2021, and a couple of weeks later he got COVID for the first time, and our lives changed.
It started with just a bit of a cough, and after a few days we put 2 and 2 together and realised it was COVID.
Our daughter also developed COVID. Little did we know at the time that it was actually the start of what is a continuing nightmare.
My mum was in a care home, having been diagnosed with dementia. We had the lockdown, so I was unable to visit my mum. The care home was closed to visitors.
My wife had been an Addison's sufferer, and regularly she had to have hospital treatments. Then the dreaded day came where we had the phone call. She'd acquired it in hospital.
She caught COVID in January 2021 during that lockdown. We never found out how she caught it. We were all so careful.
So my mummy was a care home resident. My mum really relied on her family.
I've been indoors for like 3 years. I just can't get it around my head to go out on my own anymore.
It was my dad who I lost during COVID.
I lost my lovely husband.
I lost my father to COVID in April 2020.
My father was 104 years old when he died of COVID.
I lost my dad in the pandemic. He was on the younger side, I think. He was 63.
My wonderful husband lost his life to this terrible virus on March the 1st, 2021. Well, now it's 2 years now for us, really, as a family. We have been isolating ourselves. We have been clinging together, trying to keep away from the world. But the effect on the family is devastating.
Phone went. Can you come into the hospital? What time? He said, now. I said, what do you mean now? She's only got a few hours left. We sat by her side till 11:28 on a Saturday when she finally passed.
I know that particular day, it's just a day that I'll never forget. We were told that my mum's care home was going into, a full lockdown. Window visits, for a long period of time is all what we were offered. We got a phone call from the care home to say that my mummy was being rushed to hospital. So my mummy had contracted COVID in the care home and passed away in January 2021.
The home lockdown on the 12th of March, and we never saw him again. People were becoming ill, not necessarily with COVID because there was no testing at that point. He was given antibiotics for what they thought was a chest infection, but unfortunately he deteriorated over that weekend, and by the time the ambulance had arrived, my father had deteriorated even more. We get into a hospital, we got a call from the doctor to say that they had COVID.
I've lost people to illness and I've lost people in sudden ways, and with Dad it felt like both at the same time. I knew he was ill, but it didn't feel real because you weren't doing the normal things you'd do if someone was ill. You weren't seeing them, you weren't talking to them. He went downhill very quickly, and I got a phone call from my brother like 3 in the morning, and he said, come to the hospital. And it all came very real, and it was very clear, I think as soon as I arrived, that it wasn't going to be good news. I was like, they've called us for a reason. So I went up and got kitted in the full garb, and I sat with my dad for a bit, and I could see how bad he looked and how bad things were going. So then Dad passed, and we sat with him, and so we were really lucky to have those moments.
I had a call to say that my mum had a bit of a cough. I didn't know it was COVID until after my mum had died. But this loss of my mum in those circumstances was like nothing I have ever experienced. The guilt that I live with daily, because she was in a care home and because she should have been with me. There's been no closure It's like she's still there.
He was taken in an ambulance and spent 18 days in hospital. I got to see him the day before he passed for 10 minutes. It was quite harrowing, but I'm glad I did, as a lot of people didn't get to do that, so I was one of the lucky ones. Sadly, he passed away the next day.
The doctor said that the prognosis wasn't good, that he might not survive the night. Did I want to be called if anything happened? Later that morning, the consultant rang me and said that he had deteriorated and they were allowing one family member to make an end-of-life visit. I got to the hospital. I stayed in the room with him for some time, and then the nurse suggested I come out for a break and said, you can go back later. You know, he was looking at me and I, kind of said to him, I'm sorry, I've got to go. And he pulled the covers back and I said, well, I'd better get ready then, and started to get out of bed. And I'd say to him, you've got to stay, I've got to go.
One night at the end of January, she collapsed and she lay on the floor all night on her own. And it was only when she came around in the morning and called for help that somebody came. And she tested positive when she was admitted to hospital. Just at the point where we were starting to think that she would be turning a corner any day, she had a stroke. And we knew at that point that she couldn't survive it. But it happened so quickly. And we were lucky because we got to see her, and I have no idea if she knew we were there. I was sitting there holding her hand, listening to her panting like she was running a marathon, and that was how she was breathing constantly. It's no wonder that she couldn't survive it. Nobody would have been able to survive that.
We were not expecting it to be so sudden. I've lost my husband, the children have lost their grandfather and their father and grandfather, and it's terribly, terribly sad. It's probably a bereavement like no other, because people have not come across this before.
I came out of isolation. I thought the worst was behind us, and about 5 or 6 weeks later, I developed what we now know as long COVID. As time went on, we had multiple 999 admissions, had to call the paramedics for breathing issues, mostly heart palpitations.
Collapses.
Yeah, passing out, blacking out. Our daughter was unable to even stand for a long time. And that was really scary because I was so ill. Everything fell to my husband. The doctors didn't have any answers. They were firefighting the acute infections, and it felt like we were a nuisance. And because we could breathe, that was the benchmark for healthcare. She was in so much pain for so long, 14, 18 months, being told that it was in her head. She needed to try harder, do more exercise, be more positive, and yet the pain would cause her to black out, and she would be paralysed with the pain. She would have what we think are seizures. And they just kept telling us there was nothing wrong. We should be reassured because the tests weren't showing anything.
He was tired all the time. He had headaches kind of all the time. But everyone was saying kids aren't affected. Best place for them is school. He was so ill that he could no longer sit up in bed. His eyes were bloodshot. His ears hurt. His chest hurt. I mean, he was ill. And that was my darkest moment. And he was 8. Obviously, he couldn't go to school. He couldn't leave his room. My son now uses a wheelchair when we leave the house. He hasn't been able to access education in any meaningful way for 1.5 years. He sometimes goes in for an hour, sometimes he manages a couple of hours in a week. When he goes in for that 1 hour, it takes him a long time to get dressed. Giving him medication so that we can control his nausea when he gets into the car. So I wait outside for him, and he comes out and he's shattered. And then he'll have to completely and utterly rest for the next 2 days in order for his body to recover from the physical and mental impact of going to school for an hour.
COVID was hard, really hard, because if I caught it with my health problems, I would certainly go in hospital. And I thought, well, with all the people passing away, I'm going to be one of them if I go in hospital. So I had to keep myself indoors, out the way of everybody. I'm a people's person usually, but I'm not now. This is what COVID done to me. Before, I would have just gone up to anybody and spoke to them. It's just made me a different person. I don't know if I'll ever get back to being the real me. It's all gone now. I don't know if it'll ever come back, but I'm surviving, so, you know, it's all right. Just something got to get used to, you know. It will get better, I keep telling myself that. It will.
We are absolutely devastated by the effects it's had on us, on our family, with the symptoms that both of you have been having and stuff.
So she was completely isolated medically, physically, emotionally, socially, and that took its toll to a point where our child was completely unrecognisable from the child that we'd had before the pandemic.
We don't know if there's ever going to be light at the end of the tunnel for both of you.
It's mentally and physically exhausting. Every day is hard. He was a bright, happy, active kid. And he's now isolated, alone. And as a family, we're isolated and alone. My world has been turned upside down. The future that I thought my family would have is not what I expected. It's really hurtful when people say that there's no such thing, or that children aren't affected, or it can't possibly be that bad.
People have lost their health to COVID and lost the life that they had, and that their children have lost the lives that they had. Our daughter's lost her entire teenage life. And that deserves an answer.
How do I feel? I think that's best for others to judge. I purely exist now. You learn to cope. Every day is a charade. You put a mask on for the outside world, but the loss is immense. It's not like a normal bereavement. There's so many unanswered questions. We need answers.
As a family, we couldn't be together, which was terrible. Obviously, you can imagine a man of that age, 104. We called him a legend. And he shouldn't have died, though he died. He shouldn't have died when he's own the guilt that you carry. Because why didn't we just keep him at home? And it's just so sad that he died the way he died.
But during his funeral, every one of us used the word robbed. And I thought it was really interesting because it just felt like such an injustice that we had like this woefully inadequate funeral for a man of the stature that I saw my dad in and other people saw him in. It felt like a huge injustice and hugely unfair. I think funerals are such important ceremonies of grief, because what I really wanted to hear from people at that time is I wanted to know the stories about my dad that I didn't know, and there wasn't that opportunity. But grieving in lockdown is very difficult. It is horrendous to go through that grief and have a whole lot of questions with no answers.
People shouldn't have to go through this again. And we want some answers, mainly to stop anybody, any family from having to go through this again. Our lives are changed forever.
We weren't able to have a proper burial for my mummy. We weren't able to have a proper service, funeral service, you know. We were able to have only 15 people, you know, at my mummy's graveside. We will never, ever, you know, get our loved ones back. But there are things that I will never, ever forget.
We had a very small funeral. We couldn't sit together. We couldn't have a wake. So I really wanted this end of life to be dignified and with lots of family and lots of friends, but obviously that wasn't going to happen. It's quite surreal. We didn't get to see our loved ones in the Chapel of Rest. We didn't see them, so we think that they're still alive. I know that might seem a bit crazy, but we see them in crowds, and I just think that my dad was in a body bag, in a hospital gown. He couldn't do any of those things that you would normally get to do.
To compare the grief after my wife's passing was the day of a funeral. 8 people only allowed to attend. And then to find out later revelations that the day of my wife's funeral, under those draconian restrictions, our government officials were holding parties on the very same day. My wife deserved better.
That you didn't have that sort of rite of passage that other people are allowed to have. Well, I suppose it's just kind of rituals, isn't it, to help us to deal with such terrible loss. And people who've lost somebody from COVID have had none of that, none of it. So I think you are traumatised. People overuse that word in everyday life, but this really is a trauma.
It's been a journey like no other for me, because nothing was normal. You know, we couldn't celebrate my mum, we just couldn't do anything. Hopefully, they will learn from it. So, because I wouldn't wish this on anybody.
And when it came to her funeral, we couldn't get together to grieve, to mourn her. We ended up trying to comfort each other in a freezing cold car park in February, standing 2 meters apart from each other. I am so angry about the fact that that was able to happen. That despite all the care that we took, that we isolated, that we didn't see each other, she wasn't being careless at all. And that's the thing that stays with me to this day. It's the guilt that she was on her own.
I don't know what the future holds anymore. Every day is uncertain. It's hard to accept that I have a disabled child, and it's harder for him to accept that he's now disabled.
What does our future look like? What does my daughter's future look like? Who's going to be there to support her if she can't support herself? Having long COVID is horrendous, but having a child with long COVID is far worse.
I'm not sure that I actually ended up grieving properly. Something that partly kind of worries me is that perhaps I kind of put it to one side and buried it away, and now I'm not sure I can access it anymore. People are saying, oh, well, isn't it about time we all moved on? And I think for those who've lost someone, that's not an option. It's not just the fact that my dad died, it's the how and the why he died. And that's what I need to have answered, that's what needs to be addressed. And that's what I hope the inquiry can help do.
Unless we learn these lessons and implement changes to prevent it, it will be a futile exercise. I want accountability, and I want ownership of what went wrong and by whom. And hopefully I can then move on and have a normal life whatever that may be.